My name's Meera. I'm a surgeon in London, and I'm very much interested in looking at early detection of patient deterioration and having a better escalation response. I'm guessing I'm preaching to people that aren't surgeons, so it'd be nice if you wouldn't mind just telling me a little bit about where you're from and what you do. Is it okay to... where are you based? Ah, okay. And anaesthetist? Okay. And... Okay, brilliant. With Medtronic, okay. Okay, fantastic. Great. And are you training or... Yeah, okay.
I'm an anesthesiologist from the Czech Republic.
Okay, fantastic. So this can be interactive, and there's a short presentation, and then we can have a little chat about things afterwards. Okay. So my background is I'm a surgeon, and I work in central London and Charing Cross. I'm a breast surgeon by background, but I'm very much interested in looking at early detection of patient deterioration and having a better escalation response. And some of this is through new technologies such as wearable technologies. So we know that there are lots of system challenges. We know that we have shortages of nursing staff who are quite burnt out and stressed. There's a lot of bank staff, a lot of high turnover on the wards. We also know that patient monitoring hasn't changed significantly over the last 50 years or so, with intermittent monitoring 4 to 6 hours apart. So what we're trying to do is see if new technologies can help bridge the gap, and so that we know which patients are deteriorating in real time. And compounded with all of these challenges, there are also regular strikes that are affecting the workforce. So all of this can have potentially detrimental impact to patient care and monitoring. The surgical patients are challenging and changing. Obesity is a major health problem, not only in developed countries, but also in developing countries. And this can have a major impact to our patients from everything from top to toe. So problems neurologically, obstructive sleep apnea, cardiac issues and monitoring, respiratory problems, metabolic syndrome, diabetes, and so on. The list is really endless. And this can significantly impact patient care. So I've seen patient deterioration on the wards right through from being a junior doctor to now being an attending. Post-operative surgical patients are challenging. They're at high risk of developing complications, and often these occur in the ward setting as opposed to in the sort of OR setting. And adequate patient monitoring is really crucial for early detection of deterioration. Sepsis is a major health problem. We know that the mortality is as high as 1 in 4, and for every hour's delay, the risk of death increases by nearly 8%. So detecting these patients earlier can really affect outcomes. There's not a day that goes by without it being in the major headlines. This was BBC News a couple of days ago about how a boy's sepsis death was perhaps neglected and contributed to. The causes of infection are often the common causes are lung problems, urinary problems, and wound infections. It would be interesting to see in your countries whether or not you have like a national early warning system. Is there one in the Ukraine and Czech Republic that's being used? So News was one that was adopted in the UK by the Royal College of Physicians, and it was basically a way of objectifying illness severity and outcomes. So prior to this, care varied from one hospital even 20 minutes down the road to the other. So we wanted everyone to talk the same language, and now this is routinely used in all adult patients. This is an example of a news chart that we use in the UK, but everything from airway, breathing, circulation, disability, and temperature. And there's a stratification. So amber and red alerts are for severely unwell patients, as opposed to those in white where observations are normal. So the patient safety challenge is twofold: having an earlier detection of deterioration, but also having a better escalation response. And this is where we're looking at new technologies and digital solutions. The acceptability of monitoring is now sort of applicable to the general public, and it'd be really interesting to see if those in the audience monitor step count, vitals. Does anyone do that? Do you all have hands up for everyone using some kind of digital tech? Okay, that's pretty much everyone in the audience, although we are a niche audience, so that's not necessarily acceptable to the members of the public. But we know that wearable technology is a lot more acceptable now with, commercially available products as well as medical grade devices. Wearable sensors this is a narrative review we did of technology from the early sensors that were placed under the patient's mattress to more now wearable technologies that are able to measure vital signs more continuously than intermittent monitoring that we currently have. So one of our main studies was really looking at the acceptability and the reliability of wearable sensors in real time. And we did a prospective study in acutely unwell patients that were going to stay in hospital at least over 24 hours. And they had normal telemetry monitoring as well as bedside observations. And we recruited nearly 600 patients into the trial. And as well as looking at the reliability, it's really important to look at what do staff think in the wards in real time, from junior nurses to senior nurses and junior doctors to senior consultants. And we found that continuous monitoring really will be the next thing in improving patient care. Senior matrons were focusing on whether this would help monitor overnight and at weekend cover. They thought it would be a better way of relaying information quickly and detecting deterioration quickly and in real time. Overall, the main themes were highlighting the problems with current monitoring. We know that there are failures to escalate, equipment problems, staff variation, and lack of recognition. Hopefully, new continuous monitoring will impact staff to improve workload, better decision-making, and ease of use. And this will all help improve patient care, not only with nighttime and weekend monitoring, but will have a positive impact. This can be greatly seen in patients with sepsis, but also acutely unwell patients. It was also really interesting to see what patients thought about the process. A lot of patients had said that they'd forgotten that they'd had it on. They'd really thought it would be an adjunct to care. And I think the key is making sure that it's easy to use, simple to use, and not affecting their daily activities. The main themes were around centralized monitoring, safety. They thought it would be future care, and improved comfort and usability. Next, we'll just run through a few surgical cases in which we've seen this to impact care. So this was a patient of mine a few months ago. This was a 75-year-old lady that was awaiting breast conservation and an axillary node sample. And she was very challenging, high risk. I'd normally do her first on the list because she had COPD, previous sepsis, and ITU admissions. Unfortunately, she had this infection, and this meant that I had to perform her last on the list and not to affect the flow. And she stayed in overnight. Now, this could have been a case where continuous monitoring would have helped facilitate same-day discharge. So if I knew that I was having regular monitoring at least 2 to 3 hours, instead of 2 to 3 hours apart, but every sort of block of 3 hours of monitoring, I'm much more likely to send her home if she was well and then keep her in the hospital. Similarly, this was a lady requiring a mastectomy and a sentinel node sample. This was a lady that had multiple comorbidities. She stayed in overnight, and I only had intermittent monitoring that was normal. But if we had continuous monitoring, we may have detected that she was actually becoming sicker. She was discharged back home and required a readmission into hospital. So I would have had a much lower threshold to send her home if I knew that the monitoring was pretty bad and she was unwell in the hospital. And then finally, another example of a lady that I'm due to operate on. I've already operated on once, and she's due to now have an axillary clearance. She has asthma and cardiac issues. She needs to stay in overnight. And if I had continuous monitoring, I'd much more likely be able to send her home if all of these parameters were well than keeping her in hospital, and that necessitates, you know, a £500 to £600 stay, which we could negate if she was discharged the same day. Thank you very much for your time, and we'd now like to demonstrate the portrait system, and then we can go through a quick Q&A.